Your arm-type automatic blood pressure monitor is a digital monitor intended for use in measuring blood pressure and pulse rate in adult patient population via non-invasive oscillometric technique, in which an inflatable cuff is wrapped around the arm. It can be used at medical facilities or at home. The components are included: the body, cuff and printed instruction manual. Pre-test preparation. Insert battery. Remove the battery cover. Insert 4 LRO3AA Aperful batteries into the compartment, and ensure each battery is in the proper direction. Adapter usage option. Time setting. Press start button when power on. The year will be flashing, and then use M button to set year which you want. Press start button when you confirm the year. Then it will enter into the month and date setting mode. Continue above steps to set the month and date. Voice setting. Press the start button again to switch to the voice switch. Press the M button to turn on or off the voice. Unit setting. Continue to above step. The unit will be changed when press M button each time. Press start button when you confirm the unit. Note: all these factors will influence the measurement result. Measuring procedure. Put the cuff on a table flatly, with the Velcro side down. The Velcro closer will be facing outwards. Now, pass the end of the cuff through the metal loop so that a circle is formed. Push the cuff over the left upper arm, so that the 2 points in the direction of the lower arm. Wrap the cuff on the arm. Make certain that the lower edge of the cuff lies approximately 2 to 3 centimeters above the elbow and the rubber tube leaves the cuff on the inner side of the arm. The cuff should be snug on your upper arm, so that you can fit 2 fingers between the cuff and your upper arm. Lay your arm on a table palm upwards, so that the cuff is at the same height as the heart. Do not bend the tube. Press the start button. All symbols appear on the display. You can hear 2 short beep after 0 flash for 2 seconds.
Attention, the measurement is starting. Please relax. Do not move or talk.
Then the pump begins to inflate the cuff. The rising pressure in the cuff is shown. After the suitable pressure has been reached, the pump stops and the pressure gradually falls. The cuff pressure is displayed. In case that the inflation is not sufficient, the device automatically reinflates to a higher pressure. When the device detects the signal, the heart symbol on the display starts to flash. You can hear the beep for every heartbeat once the heartbeat signal is detected. When the measurement has been completed, you can hear a long beep. In the meantime, the diastolic and pulse rate will appear on the display.
Your blood pressure is systolic 119, diastolic 78, and pulse is 55. According to World Health Organization standards, your blood pressure is considered as optimal.
The measurement readings remain on the display until you switch off the device. If no button is pressed for a period of 3 minutes, the device switches off itself in order to save the power. Note: if it is necessary to interrupt a blood pressure measurement for any reason, e.g., the patient feels unwell, the start-stop button can be pressed at any time.
We wishes you all the best. Stay healthy.
The device immediately decreased the cuff pressure memory recall of measurements. This blood pressure monitor automatically stores 1,199 sets measurements value. The oldest record will be replaced by the latest measurement value when more than 199. Press the M button when power off. The last measurement value will be shown, as well as subsequent measurements can be displayed one after the other by pressing the M button each time. Memory clear of measurements. If you are sure that you want to permanently remove all stored memories, press the button M until it is shown CL. After this, press button M. Then all the records will be cleared. Like, subscribe, bell. Know myself, enjoy my life.